Welcome to State of Affairs. I'm Steve Adubato. We're coming to you from the Agnes Varus NJTV studio in Newark. It is our honor to introduce Cathleen Bennett, who is the president and CEO of the New Jersey Hospital Association, formerly in the state of New Jersey, held a significant role, which was?
The Commissioner of Health.
Oh, yeah, that role.
Yes.
How different is this role?
This one's pretty different. In the role as commissioner, you worry about regulating hospitals and other licensed health facilities, and you worry about public health. Those are the two really significant roles. And here at NJHA, I'm now looking at not just what are the roles of licensed facilities, because we have hospitals, we have the whole post-acute continuum, we have behavioral health providers. We're also thinking more broadly, what's our role in terms of promoting health overall, improving the health of New Jerseyans?
And let's get right into it. If you're listening to on the audio side, Cathleen Bennett is the president and CEO of the New Jersey Hospital Association Vaping. You can't go anywhere without hearing it, seeing it, the media covering. You and I were just talking before we got on the air. First of all, how bad is the problem?
Oh, it's pretty significant. I think it's our next, major public health crisis.
Because?
So if you take a look at vaping, here in the country, we're seeing vaping-related illnesses that are creating serious lung injury. We're watching the CDC say that they have 40 people that have died from vaping. They're investigating hundreds of cases. Here in New Jersey alone, we have one person that's died, and we have 30-plus cases under investigation. This is a real significant issue.
Kathy, how young are kids? Because I just told our daughter is 9, and I can't even comprehend it. And you said?
Gosh, our Center for Health Analytics, Research and Transformation just finished doing a study, and we're on track this year to see 16,000 people present in the hospital and having said that they actually vape as young as 10 years old.
10?
10.
How? How are they getting access to it?
I think that's a really good question because, we have the New Jersey Smoking Act, which says that you have to be 21 to buy tobacco products, including vapes and e-cigarettes. So how are, those young as 10 getting their hands on it? It's clearly, coming through, getting somebody else to acquire it.
From your perspective, do you believe that, and there are efforts to do this, do you believe vaping should be banned?
So, I think it's a little premature to talk about banning vaping. I do believe, though, that you need to be over the age of 21. What we see are these long-term, health impacts, for example, that have been associated with tobacco. But we didn't know it when tobacco first came into, great popularity. If you think back to the 40s, the 50s, the 60s, it wasn't until 1970 that we banned, cigarette advertising on television. And now we have this new thing that came about, and just, it's relatively recent, and it's another nicotine delivery system.
One more quick follow-up on this. And our executive producer, Jackie Heyer, were just talking about this. We're going to bring in some folks from the vaping industry because they testified before the current commissioner of health, Judy Purse-Kelly, who held a hearing. And some of those vaping advocates said, you know what? This is, vaping, a safer alternative to smoking. We're going to have those folks here. You know that testimony.
Yes, I do.
You buy it?
So, I think that there might be a role. I don't really know what it is. But, clearly, a lot of people came out, they testified, they said that it was the thing that got them off of tobacco. And frankly, moving from tobacco to an alternative makes sense. But whether or not vaping becomes, the new addiction, that's another, I think, big issue that bears exploration. That's one of the reasons why at NJHA we're looking at this, and we've created toolkits, and we're pushing them out to our members and other clinicians so that, we start to ask questions and code what's going on with vaping. How often do you vape? Do you vape with nicotine? Do you vape with THC? We're looking at all those other types of additives because we've got to figure out what's that causal relationship with, different diseases and illnesses.
And while you're listening to Kathy right now, check our colleagues at NJTV News. Have been doing a tremendous job covering the vaping issue every day. New information. Switch gears. I want to cover two things. One, there was a mental health conference that you had, that the Hospital Association had. What were some of the key findings?
So the conference, and it was really well attended, was called Suicide and Stigma, taking the conversation out of the shadows. And we had one from school officials, guidance counselors, to clinicians, to mental health providers, to families coming in and wanting to talk about, the stigma that attaches to mental health issues, the rise that we're seeing in depression and anxiety, particularly amongst preteen girls, and how that leads to things like suicidal ideation, attempted suicides, and some that actually die by suicide.
We get any better in this area in terms of the stigma?
In terms of the stigma, I think
More accepting. Sorry for interrupting.
I think in terms of the stigma, we're starting to see some improvement because take a look. The New Jersey Hospital Association hosted a conference that sold out.
Groundbreaking.
Groundbreaking.
People care. People want to know. Those of us who have teenage children, pre-teenage children, you better care.
Exactly.
It's an epidemic.
It is. And what we're hopeful for, and one of the toolkits we'd love to see take place, is have your child's pediatrician or their adolescent physician ask questions as part of a normal primary care visit.
By the way, when next time Kathy's up, let's put up the Hospital Association website. I'm sure we've been doing it throughout the program so that people can find out more. The other epidemic we've been talking about a lot, the opioid crisis. I know there's an initiative that the Hospital Association is collaborating with how many other hospitals?
So it's the Hospital Association, and we're working with the Department of Health, the Department of Human Services, who gave us a grant. We're also working with St. Joe's, which created the ALTO program, and we're sharing opioid reduction options with 11 other hospitals.
But let me just also ask you this. Is there a model, because I know our friends over at St. Joseph's Health have talked about this. There's an ALTO, it's an alternative to opioid initiative. Is that the model?
So,
or are there multiple models?
There's a couple of models. ALTO is definitely one of the leading ones in the country. As a matter of fact, you might recall you were there for it when Senator Booker announced legislation, and it became the first real bipartisan act of this current administration.
President Trump signed legislation.
Correct.
Which did what, Kathy?
It signed ALTO into law and said we're going to create funding to move ALTO out to hospitals throughout the country.
Hospitals, and again, I read a piece that you wrote about this. Hospitals must do a better job being a part of the solution in terms of alternatives to these dangerous opioids.
Right. Hospitals for years have been dealing with the Joint Commission requirement that says pain, it's the fifth vital sign in essence. And so there's a lot of information, around how satisfied are patients with their visit, did they, get what they wanted. And when you're looking at pain and pain management and somebody's coming in and, they're passing a kidney stone, what are you seeing? Well, you might be hooked up to an opioid, IV drip to try and manage those symptoms. And programs like St. Joe says, you know what, we've got some alternatives. We want to do something besides opioids. And so they take a look at, can we use a nerve block? Can we use nitrous oxide? Can we use a combination of alternatives to still manage the pain? And, also recognizing sometimes opioids are the right prescription.
But not the first resort. Cathleen Bennett is the president and CEO of the Hospital Association in New Jersey. 101 years they've been at it. Thank you so much, Kathy.
Thank you very much.
Thanks for joining us on State of Affairs. I'm Steve Adubato, coming to you from NJTV. We'll be right back after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Northward Center, the New Jersey Economic Development Authority, Valley Bank, Holy Name Medical Center, NJIT, the law firm of Gibbons, P.C., and by Choose New Jersey. Promotional support provided by AM 970 The Answer, and by Jaffe Communications.